Hi guys, I'm Dr. Konstantin and I'd love to talk to you today about short scar facelifts. If you want to find out what those are and whether they're good for you, stay tuned. You will learn everything about it. Short incision facelift seems like one of those things that make perfect sense, right? You look into it and you say, oh my God, if the incisions are shorter, obviously it's not as invasive, so they're going to be less pain, the recovery is going to be quicker, and then of course the doctor doesn't have to make all those incisions and put all those stitches, so the lift must be cheaper. And at the same time, you should get pretty much the same results. So you get all of those good things, but there is no downside. Or is it? Let's find out. So what happened after people started doing short incision facelifts, they all of a sudden realized that short incisions don't heal so well. And they look a lot more noticeable. And there are other problems. There are skin pleats, there's extra skin, keloids on people who really should have healed pretty good. So what's going on? Let's try to figure it out. So when we make facelift incision, and this is a very important concept, and we are going to illustrate this with a diagram. The incision is kind of curvy and wavy and it goes around the ear, but if you simplify all that and you get rid of all the curviness and just think of the geometry of how we pull the skin and rearrange everything, it becomes very simple. The incision on one side is actually shorter than on the other side. But it's really not a big deal because the skin is elastic, so we can kind of match it all together, and by putting stitches in a radial manner, we can bring it together and the resulting incision is going to be straight and it's going to heal well and it's going to look nice. But now look what happens when we make incision shorter. We're removing exactly the same amount of skin, but all of a sudden once we start pulling that skin towards the short segment of the incision, it's going to start bunching and forming pleats, and the skin elasticity is just not enough for us to be able to put all the stitches and make the incision looks nice and smooth. So for that reason, when people started doing short incision facelifts, they realized the skin really doesn't want to stay this way. It doesn't look good. There's so many problems with it that maybe it was not a good idea to begin with. So, since those incisions are not healing so well, should we abandon the whole concept and start making incisions longer? Well, not really. Like many other things in life, it's always a balance between the incisions that are too long, and obviously we don't want to do that because it means more surgery, more stitching, more cutting, and the incisions are just that are way too short, and in this way, they're just not going to heal well. So we are getting a perfect balance nowadays. When we're doing the facelift, the more skin we remove, the longer the incisions have to be. And I tell this to all my patients. So if we make incisions too short for the amount of skin removed, it's just not going to heal well. If we make it too long, well, there's really no point doing that. So short incision facelifts, good idea if you don't have much skin removed. If you have a significant skin laxity, incisions have to be longer. This is Dr. Konstantin. Please like, comment, and subscribe below. Hope to see you again.